My name is Mark Ryberg, and I'm Managing Director and Head of the Physician and APP Workforce Practice at SullivanCotter. And I've been here at SullivanCotter for 10 years, working in all facets of physician compensation, including fair market value work, the evaluation of highly compensated providers, including luminaries, as well as provider compensation design. You know, if you were to ask me about generational preferences and the impact they're having on provider compensation, say 5 years ago, I probably would have been a bit at a loss. Because at that point in time, we had seen such consistency in the structure of compensation in the employed and even in the contracted space relative to provider compensation that it wasn't really an issue. But in the last 5 years, we've really seen a demonstrable change in the impact of generational preferences. And it really crosses the full gamut. It's not just about compensation, and it's not just about base salary, it's about compensation in totality. That's everything from how am I paid, what am I paid, what are the benefits I'm receiving. So really a more comprehensive perspective on compensation, which probably didn't exist in the past, or at least didn't exist to the level of interest that exists today. And it's challenging a lot of conventional compensation designs, right? Let's use academic medicine as a classic example. In academic medicine, there's often models that are heavily tenure focused. But with increased demands from younger generation or newly graduated physicians, those demands for more competitive base salaries and for more compensation that's secured and less compensation at risk in the form of incentive pay is creating real compression between the way the physicians who have been there for significant tenure and those who are new are being compensated. And that creates pressure, right, relative to both recruitment and retention of established physicians. New physicians entering the workforce are also demanding pay in a different way than maybe some of their colleagues who have been more tenured. One classic example, for the last 5 to 10 years, we've seen the majority of physician compensation in the employed models being driven by production, meaning physicians are typically paid relative to the amount of volume or work RVUs that they're able to produce inside of that organization. Now, the manner in which that's changing is that younger physicians don't want to be at risk relative to the production or the amount of volume that they can generate for the organization. They're looking for more security in the form of base salaries. So as that increase in the interest of more secured pay comes into play, it challenges the conventional model that's been used, the conventional model being production. And so not only does it change the way we're paying, but it also changes the way in which we need to manage performance. And so that's another consideration to how generational preferences are impacting pay and pay practices and performance management. I would also note that we're starting to see the emergence of some new benefits. Younger physicians are putting more of a premium on housing, on student loan forgiveness, on childcare. So that's really starting to evidence a shift in the types of benefit components that younger physicians are looking for in their total compensation package. You know, historically, physicians took the employed physician benefit package and there was little to no debate about what was in or what was out. It was just accepted as it is what it is. Today, it's a very different discussion. Physicians are coming in and they're looking for very specific benefits, and sometimes that can be the defining point between a physician accepting one offer versus accepting a competitor's offer. So it's forcing organizations to think more creatively about not just the compensation program that they're offering, but the benefit plans that they're providing as well.